Hi, this is Dr. Tara Rasta. I'm here to talk to you about sugar metabolism. I've been studying a lot about brain health, and one of the most important factors in order for you to have a healthy brain is to have a healthy sugar metabolism. So I'm going to give you 3 patterns of sugar metabolism. The normal one, the one that has hypoglycemia, which means that your body has too little sugar, and then the last one, which is insulin resistance, in which the receptors of insulin are not responding to sugar to bring in sugar into the cell. So if you're somebody who has a normal sugar metabolism, which is very rare, you're somebody that you wake up with a lot of energy in the morning, you are hungry in the morning, you do not become dysfunctional if meals are missed, or if you do intermediate fasting, you even feel more energy sometimes. You are somebody who has no problem falling asleep or staying asleep throughout the night. You do not really need caffeine or any type of a stimulant in order to keep going, and you do not crave sugar after meals. If you are somebody who has hypoglycemia or functional or reactive hypoglycemia, you are somebody with too little sugar in your blood and in your cells. You are somebody who wakes up in the morning but is extremely tired and has a hard time getting out of bed. Your cortisol hormone doesn't kick in until later throughout the day. You're somebody who relies on caffeine and stimulants in the morning in order to get going. You have a very slow morning start. You're somebody who has no appetite in the morning. Your appetite kicks in 2-3 hours later, and when it does kick in, you are craving a lot of sugar, something really sugary. You're somebody that if meals are missed, you are very irritable, and you may feel that you get very jittery and it's hard for you to function. You're also somebody who has a hard time staying asleep throughout the night. Sometimes you wake up in the middle of the night and you feel hungry, and in order for you to fall back asleep, you may have to eat something. The third pattern is insulin resistance. Insulin resistance either means that you have too much sugar, where the insulin receptors are no longer sensitive to sugar, or you are somebody that for whatever reason the insulin receptors are not responding to binding the sugar and bringing the sugar in. You're somebody who wakes up in the morning but feels tired. You're somebody who wakes up in the morning and you're super hungry and you're craving to eat something. You like to have sugar or salt throughout the day. You feel fatigued after meals, and a lot of times you have a crash around 3 or 5 p.m. And you're somebody who has a hard time falling asleep at night. The best way to diagnose you, which type you are, would be through a blood work, but I do have an assessment form that through the questionnaires I can figure out if somebody has hypoglycemia or insulin resistance. If you are somebody who has hypoglycemia, intermediate fasting is not for you, because you are somebody who's already, your blood sugar is already too low, and intermediate fasting, instead of helping you, can actually cause you to go a little crazy because your brain is not getting the glucose that it needs. If you are somebody who's insulin resistant, on the other hand, you can respond really well into intermediate fasting. So what do you do if you have hypoglycemia, reactive hypoglycemia, or functional hypoglycemia, which means that you're not diagnosed with it, but you have the symptoms of it? So when you wake up, the most important meal for you is breakfast, even though you don't want to have breakfast. So what do? You wake up and you do some high intensity exercise for 5 to 10 minutes. You can do 10 jumping jacks, 20 jumping jacks, you can do 20 deep squats, you can do inchworms, and you do it as fast as you can within the first 15 minutes when you wake up, for 5 to 10 minutes. And once you do that, you take a shower, and then you should feel a little bit more hungry. Your breakfast should mainly compose of protein and fiber and vegetables, and least amount of starchy or sugary food. And you should not be drinking caffeine in order for you to keep going. You can have green tea or some kind of, a little bit of a caffeine from tea, but not necessarily coffee, because you already have an issue with your cortisol response, which is your waking response. If you are somebody who has insulin resistance, it's best suggested that you could have breakfast. Breakfast is also the most important meals, but you can wait till a little bit later, so you can do intermediate fasting. And it's really important for you to avoid sugars after meals, to avoid salt throughout the day, and to just keep drinking water to make those insulin a little bit more sensitive to sugar, by avoiding things that are sugary, such as grains, such as bread, such as rice, things that can break down into sugar right away. So this is just a really simple video for you to understand the different patterns, but if you're interested to know your pattern, contact me. I can send you the assessment forms, you can fill it out, and I can let you know about different functions of your body, as well as if you are hypoglycemia, if you have somebody who has hypoglycemia, or if you have insulin resistance. And I can also order blood work for you, and we can just go a little bit deeper on what you may need. Thank you very much.